Hi, this is Dr. Antolak at thegeneraldentist.com in Shelby Township, Michigan. What I'd like to discuss today is oral cancer and cancer in general and its effect it has on the mouth. When someone is diagnosed with cancer, it's obviously a horrible time usually for families dealing with this potentially life-ending illness. And when that takes place, a lot of things have to be done in place. And your oncologist that you would go to hopefully will be really privy and aware that during any radiation therapy that's done, or even chemotherapy, these are intended to kill off cells in the body, fast-growing cells, which are usually, obviously, they're cancer cells or fast-growing cells, but also fast-growing cells in the body are also hair cells, hair follicles, and it's the saliva glands that are in your mouth. When chemotherapy and radiation therapy takes place, that's why people go without hair, but also the mouth dries out. So what are the implications of having this take place for the patient? I believe what's very important is that once someone is diagnosed with cancer, that they really get a thorough dental examination. Hopefully your oncologist will recommend a dentist to you. And what's important is getting this done in a very quick fashion. The reason why that is when someone has cancer, they want to get onto that therapy pretty soon. Well, if the mouth is not taken care of, if there are bad teeth in the mouth that seem to be problematic, because the fact that when the saliva glands are knocked out, it causes so many problems. You have a significant potential for getting cavities. Well, if a tooth is bad as it is, that cavity is going to get worse. The problem is you just can't take a tooth out when somebody's on chemotherapy. If you do, because the immune system is really suppressed, there's a risk of having many potential complications from that. The best way of dealing with this is taking care of all these urgent needs right away while the body has the ability to heal itself before it gets struck with all this chemotherapy and these very difficult days that would lie ahead. Dry mouth is because the lack of saliva is the issue that takes place, but also there are many other things that can take place. For example, I put this brochure together, and so increased chance of cavity, you have a loss of taste, you get pain in your mouth. Of course, infections are much more prevalent. So if you have gum disease, there might be an election to have teeth removed just so that that area is sealed off and there is no seed of infection to the jawbone. You get jaw stiffness from this, and you get changes in your bone. Sometimes when medications are given, for example, what are called bisphosphonates, which are medications used in certain types of cancer, in bone cancer, it is once that takes place, the metabolism in the bone is altered, and therefore, once again, it's difficult to manage patients who need to have any other additional treatment after this treatment, dental treatment after this chemotherapy is started. So if there's questions about that, you can feel free to call me, but I would really recommend talking to the oncologist or your nurses who treat you, or your loved one who will be going in for this care, to make sure that if there's any potential of having a problem, and if you're not really current with your dental care, please get in to see us or get in to see your own dentist if you have one, because that itself could be really a really challenging time for you. So if there's any questions, my phone number is 586-247-3500. Our website is thegeneraldentist.com. We're in Shelby Township, Michigan. Thank you and God bless.